My name is Dr. Scott Zashin. I'm a rheumatologist in Dallas, Texas. I originally grew up in New Jersey, went to college and medical school at Dartmouth in New Hampshire, and then moved down here to Dallas to train at the University of Texas Southwestern Medical School. And then I began a private practice in 1989. Rheumatologists are internists who take an extra couple years to subspecialize in the diagnosis and treatment of musculoskeletal related conditions. These include conditions such as rheumatoid arthritis, lupus, fibromyalgia, gout, osteoarthritis, and a host of other types of medical problems that affect the joints and connective tissue. I first became interested in medicine when I was in 10th grade. I think my parents encouraged me to be a doctor, and then I decided to try it out myself. I volunteered at the local hospital in the recovery room, and then the next year I was able to work in the operating room. In my senior year of high school, I was able to get a job driving an ambulance in New Jersey. When I went to Dartmouth College, one of the things that they promoted about Dartmouth was that you would always be taught by a full-time professor. So as a freshman, there was a very interesting class, but I saw it was being taught by a graduate student. So I went down and met with the graduate student, and I asked him, I'm very interested in your class, but you're a graduate student. Why should I take your class? And he convinced me that it would be a great class for me to do, which I did. And then in the class, I asked him if I could work in his laboratory in the summer, and he was very kind and gave me a job helping out with his research. I really didn't know what I was doing at the time, but subsequently, his research isolated a protein that's involved in the immune system. And this PhD or graduate student ended up leaving the lab and starting his own company called Immunex, and Immunex was the company that brought the blockbuster drug Enbrel to market. And Enbrel is one of the medicines we use to treat rheumatoid arthritis and other related types of arthritis. So it was pretty neat that I was able to be involved with that research as a college student, and I'm using the benefits of that research today in my practice. The thing I like about medicine, and that it gets me up every morning, is I enjoy taking care of people and trying to solve their issues. I'm not so focused on the actual disease or condition. Each patient is interesting to me, so I find all conditions interesting, whether it's a very common type of arthritis or something more unusual. I enjoy the interactions with patients. I enjoy spending time with patients and knowing my patients. Probably about 20 years ago, there were a lot of changes in the medical industry. Insurance companies were making big changes in their reimbursement to medical practices, and what I was finding is because of that, I had to spend less time with patients. I didn't think that was very satisfying for the patient, nor was it satisfying for me. I like to spend a lot of time with them and make sure that I'm covering everything. As a result, at that time, I dropped off participating with the insurance plans. So for the last 15 years, I've stopped participating with the insurance plans. The downside of that for patients is it does cost more for them to see me, but the upside is they get my undivided attention. I'm willing to spend the extra time with them if needed. I also can get them in to see me very quickly, and for new patients, I'm able to see them also very quickly. When I stopped taking insurance, I did have a lot of time available in that first year. At that time, there really was not a lot of great treatment for rheumatoid arthritis. We only had a few medications, but shortly after, a bunch of new medications were FDA approved that dramatically changed the treatment of rheumatoid arthritis, and these were called the TNF blockers. Patients who had active disease, painful, swollen joints for many years without benefit of the existing therapies, now we're getting dramatic responses to our new treatments. As a result, I decided to write a book detailing these new medications, how they would benefit the patient, but also the potential side effects of these new medications. In fact, a big part of my practice that distinguishes me from other rheumatologists is that I'm willing to use alternative or non-traditional approaches to treat arthritis, while many other rheumatologists may not have the knowledge of these types of treatments or have no interest in learning more about them. Many years ago, I was taking care of a patient with chronic pain. He was never happy, and one time he came in to see me smiling, and so I questioned him, "Why are you happy today?" He said, "Well, I'm pain-free." I asked him how that could be. He said, "Well, I've started doing acupuncture." And that became my quest to learn about alternative therapies. I learned about acupuncture. I actually taught a class in acupuncture. And then a natural flow from that was to learn about other supplements or herbs that might be useful in the treatment of patients with chronic pain.